Here we go. It is time now for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. Let's go ahead and get to the first one. 2 weeks ago, I traveled for vacation to Arizona, and after being by the pool all day, developed this painful, itchy rash on my feet, legs, and hands. The same thing happened last year when we went on a break to Hawaii with our kids. Please help Dr. Groff. Erica with a C from Santee. Oh my goodness, what are we looking at here?
Wow, she got quite a vigorous reaction. You can see there's bumps and even some tiny blisters on her feet that she said were painful and itch. And this is a condition called polymorphous light eruption. Polymorphous just means many shapes, so you can see blisters, you can see red little bumps. But when this happens, it's usually the first exposure to the sunlight of the year. So, you know, wintertime, we're not getting much sun, and then say we go on a trip to Arizona where it's sunny, where your skin's not used to the sunlight, and you get, this only happens in certain individuals, but they get this almost like an allergic reaction to the sun. But it's interesting, as the season goes on and they have more exposures to the sunlight, it will not continue. So it usually burns itself out after the first few exposures, but it comes back every year in their initial exposure to the sun.
So do you just ignore it then and it'll go away?
Yeah, you can. It'll basically go away on its own, but it can be quite uncomfortable. So sometimes we'll give topical anti-inflammatory medications and things to help with the itch.
Gotcha.
So very
Okay.
interesting.
Next question. I have a daughter and a son. They both have a couple of these pimple-like bumps on their bellies. What are they? Jason from La Jolla wants to know. Let's look at what we're talking about right here. Interesting.
Yeah, you can see this child has two little flesh-colored bumps on her abdomen, which is a common location for these. Do you have any ideas what this might be?
I have no idea. It looks like almost like a wart.
Yeah, they are kind of like a wart. It's called molluscum contagiosum. And like a wart, it's caused by a virus. And kids can pass these to one another. Particularly in the springtime when we start to swim, use swimming pools, they can catch it from sharing towels. If you know those little swim boards that kids use, if that rubs on one kid's belly, like this little girl, and then she shares a board with another child, they can get it that way. So it's very contagious, but the good thing is they're harmless, and they tend to go away on their own after about 6 months to a year. Now, most parents are comfortable with letting their kid have these for that long, so there's numerous treatments we can do in the office. We can use topical things to get rid of them. We can actually use lasers to get rid of them. So, and the good thing about these is, unlike a wart or unlike, say, herpes, where the virus lives in our body, once these lesions are gone, the virus is out of your system.
Gotcha.
So that's good.
Okay, very good. Next question. I just had a first tattoo removal treatment with laser, and I got terrible blistering. Is this normal? It's very uncomfortable. Let's see what Sean is talking about right here. Ooh.
You know, believe it or not, this is pretty typical for a first treatment with a laser, especially.
Hard to look at.
Yeah, well, it can be quite uncomfortable too. So it's not that unusual, but what we do now, we have a new laser in our practice that actually will, first you use a tattoo removal laser on the skin, and then we use the second laser, which puts tiny little holes in the skin.
Okay.
So that eliminates any blistering. So it makes for a much safer treatment. You can see in the photo here, the first photo is obviously before treatment. The second photo shows some blistering. The third photo, you can see there's no blistering with the treatment, because we use this second laser called the AccuPulse, which puts tiny little holes in the skin that allows the fluid to escape so you don't get the blistering.
Interesting.
Yeah.
Okay, last question. I feel like my temples are caving in. What is happening to my face? And is there anything I can do? Angela from Cardiff, let's see what she's talking about right here. Okay, so yeah, kind of sinking in just a little bit.
Yeah, you can see that she looks like she's probably maybe in her 50s or so. And usually even starting in the 40s, what happens with the face is we start to lose volume. So you lose fat, the facial muscles start to shrink, and the actual bones of the face start to shrink as well. So everything's kind of caves in and starts to fall down. So what we can do in patients like her is we can actually add filler back into the temple area like we did on this girl. You can see her temples in the left photo there. Now compare that to the right. What I did was I put a filler in there called Voluma. It actually gives that youthful shape back to the face.
Gotcha.
They say a woman's face should be shaped like an upside down egg. So you have more volume at the top, and it tapers down to a narrow base.
Gotcha.
So if you picture an egg, turn it upside.
I got it.
So there you go.
I got it. Interesting.
Yeah.
Dr. Groff, thank you as always. We really
seeing you.
appreciate it. And to get in touch with Dr. Groff, the information is up on your screen. We've also linked it on our website, fox5sandiego.com. Chrissy, your face is very egg-like.